In this video, we will be discussing type 2 diabetes within Saskatchewan's South Asian Canadian population. So what is type 2 diabetes? Type 2 diabetes is a chronic condition in which the body is unable to properly regulate blood sugar levels. It's characterized by high levels of sugar, or glucose, in the blood, and is caused by the body's inability to produce enough insulin or to use insulin efficiently. South Asians are about 4 times more likely to develop type 2 diabetes. This is hypothesized to be a result of a genetic deficiency in insulin regulation. The condition can lead to serious health problems, including heart disease, blindness, nerve damage, kidney disease, and amputations. It is a lifelong diagnosis, and it's important for people with type 2 diabetes to manage their blood sugar levels through a combination of medication, diet, and physical activity, and to visit their healthcare provider regularly to monitor their condition. Let's dive into some of the barriers that South Asians with type 2 diabetes face. The first one being access to care. Some South Asian individuals with diabetes may face barriers in accessing healthcare services. This may be due to language barriers, cultural differences, or lack of insurance coverage stemming from socioeconomic background. There may also be a lack of cultural competency. What that means is healthcare providers may not be familiar with the dietary practices or the culture of South Asians with diabetes. This can make it difficult for them to receive the appropriate care, considering that their lifestyles may differ from that of the average patient that walks into a clinic or the hospital. There's also a stigma surrounding diabetes within the South Asian community. This prevents individuals from seeking treatment or support when they may desperately need it. Stemming from the stigma, South Asians with diabetes may also have a lack of support or a strong support system in place to help them manage their condition and to make healthy lifestyle choices in order to better their health. Now, let's delve into the determinants of health. The World Health Organization describes social determinants of health as non-medical factors which may play into an individual's health. This includes their education, environment, socioeconomic status, as well as other factors. Now let's look at the ecological model and how it's being used for the purposes of health promotion relating to the issue of type 2 diabetes within the South Asian Canadian population, specifically in Saskatchewan. Beginning with the individual level, this is how the individual perceives their own diagnosis of type 2 diabetes. At the interpersonal level, it refers to the individual support systems. As discussed in the South Asian Canadian community within Saskatchewan, there's a stigma surrounding type 2 diabetes. The institutional and organizational level refers to the individual's access to healthcare, in this instance, access to insurance, access to a general physician, as well as if they live in a rural or urban community. Community refers to the resources available to the individual at the community level. Lastly, structures and systems refers to laws or policies at the federal or provincial level, which may be in place to help individuals with type 2 diabetes. In order to understand where the current approach falls within the ecological model, let's describe upstream, midstream, and downstream approaches. Upstream approaches refer to policy level changes. On the ecological model, this includes organizational, community, and public policy levels. The midstream approach focuses on personal needs. As such, it focuses on the impacts the policies may have on individuals at a personal level. The current approach to type 2 diabetes in Saskatchewan, also pertaining to the South Asian population, falls within a downstream approach. This is because it focuses on treating the illness as opposed to preventing it or providing institutional level preventative methods. Individuals may be diagnosed within the pre-diabetic stage, and this would be more of a midstream approach. However, the South Asian community suffers from living within rural areas as well as being of socioeconomic status that is lower than the average Canadian. As such, their access to care is limited. The current approaches for diabetics in Saskatchewan are good. However, it's important for healthcare providers and policymakers to be aware of the aforementioned barriers and take steps to address them in order to ensure that South Asian individuals with diabetes receive the care and support they need to manage their condition effectively.